Hi, I want to thank everyone for being here today and for your commitment with this treatment process of your loved one. I'm Anthony Grimaldi. I'm the Director of Behavioral Health for Southeastern Health. And again, I want to welcome you all for being here today. I want to talk to you a little bit about what to expect and what we're all about at Southeastern. And more importantly, to help you to understand how you can be a part of the success of treatment for your loved one. I want to start off first by saying mental health disorders and substance use disorders, they are illnesses, they are diseases. They're not moral problems. We don't cause diseases. We live with them, we're impacted by them, and eventually, hopefully, we treat them. But none of you caused the disease that your loved one is experiencing, nor did they cause it. Nobody wakes up and says, I want to become a substance abuser, or I want to be living with mental health disorders. It's something that happens to us because it's genetic, it's biological. In fact, we're talking about a biological, psychological, physiological, social, and spiritual disease that ultimately affects everyone, including the family. In fact, we've often called it a family disease. There's dis-ease in the family. We're frustrated, we're confused, we're angry, we're hurt, we're disappointed, and that's all due to the impact of addiction, mental health disorders, substance use disorders. But if we don't understand that, we take it personally, and we either blame ourselves, blame the loved one that's in here, blame God, or get angry at ourselves, or get angry at God, or get angry at our loved one that's with us today, and that serves no purpose. I want to say that if your loved one got hit by a Mack truck and they're laying in the street, would you sit there and negotiate with them? Would you be asking, why did this happen? Would you be yelling at God? Would you be yelling at the Mack truck driver? Would you tell them, why didn't you get out of the road sooner? No. You would pick them up and get them to a hospital for treatment. It's the same thing with a behavioral health or mental health illness. When somebody is suffering, you don't sit there and blame them. You don't ask them why this is happening. You don't make excuses. You don't tell them to toughen up. You don't tell them that you have a moral problem. If you just became a good person, this would not be an issue. You pick them up and you get them into treatment, similar to what you've all done to help your loved one get to Southeastern's psychiatry program. I wanted to talk to you about a hallmark symptom of mental health disorders and substance use disorders, and that's something called denial. And it impacts all of us, both family members, loved ones, and the patient. It's a psychological and often physical symptom. What denial is basically your body's attempt to protect itself from painful situations. It's the inability to experience pain at that moment in time. But if denial goes untreated, it causes all sorts of problems for both family members and friends. It's almost the equivalent of the body's form of being in shock. When somebody's in physical shock, the purpose of that is to protect the body's internal organs from shutting down. But if you don't treat for shock, eventually shock itself will be the problem that can kill somebody. Same thing with denial. What does denial look like to you and me? It looks like, I'm not sick, I don't need your help, it's your fault, it's my fault, I'm just weak, I can handle this on my own, I don't need to take my medications, I don't need to be on 3rd East, I don't know why you're doing this to me, you just don't understand, I can handle it. These are the symptoms of denial, when somebody is saying things so that we don't have to deal with the painful and sometimes horrible experience of dealing with a mental health or substance use disorder. So what can we do then if we understand this? Is to be part of a treatment process, to be part of the team, commit to being part of recovery. There's an old saying that you're either part of the problem or you're part of the solution. That's not to blame anybody. Again, nobody causes this illness. But if we don't know what to do to fight back and combat denial and other symptoms of this illness, we become part of the problem. Please remember, denial destroys families and can kill people. So what can you expect while you're here today and throughout your loved one's treatment stay? First, we spend probably 24 hours minimum just doing thorough initial evaluations of your loved one. And that includes nursing assessments, social work assessments, recreation assessments, therapy and counseling assessments, activity assessments, and then ultimately a psychiatrist or psychiatric provider does their thorough assessment. We usually wait almost 24 hours before the psychiatrist sees your loved one, and there's a reason for that. It's so that everyone else can get the information they need and give this information to the psychiatrist so they can make the best treatment decision and medication decisions possible. Please don't rush this experience. Many of us want it and want it now. The patient says, I want to get out, I want to go home now. Please understand it takes days for us to thoroughly evaluate and treat and stabilize the reason that brought your loved one to us to begin with. In fact, expect that most people will stay with us between 6 and 8 days. It takes multiple days for medications just to be adjusted properly and make sure that they're working effectively and that there are no side effects. It takes days for us to assure that the therapy sessions and the classroom education sessions and the activities are actually working for your loved one. So let's not rush this journey. This is a great opportunity for folks to get stabilized and to get a solid footing in what they need to do to get well ongoing. What we ask of you, and we need you, we can't do this alone. Please ask for an appointment with a social worker if we have not made one already with you. Please, we can see you either in person or on the phone, but we want you to be part of the treatment planning. We want you to understand the medications. We need your input about your loved one's behaviors. We need your input and support and commitment to aftercare and to the medications that they're going to take when they leave the facility. Without you, again, we're talking about a family illness. We sink together or we swim together. Please understand 2 things, if nothing else, today. First of all, your loved one will not stay well once they leave Southeastern if they don't continue on with their aftercare and outpatient treatment, their medication regimen, their therapy that's recommended. They will not stay well. Second, we can't do this without you and your support and your help. You know your loved one better than anybody. You know what you've all lived with. And if it's not acceptable to continue living this way, please participate in the treatment process so that together we can learn how to change behaviors, learn about relapse, learn about triggers, learn about the importance of medications and the signs and symptoms so that we can avoid another episode. We can't do this without you. So what can you do today when you're on the unit? Well, please, first and foremost, keep the conversations positive. No need to dwell on the past. We can't change it anyway. Stay focused on your commitment to treatment, to ongoing treatment, and your willingness to support your loved one and engage in treatment after they leave the facility. Ask them about what they're learning today and what you can do to help them with that learning process. Please also ask again for a social work appointment so that you do become part of the integral treatment team process. We can't do this alone. Please don't bring anything to the unit, gifts or food, and if you do bring something, please ask the nurse before we give it to your loved one. We do not want anyone to have a reaction to anything that they might ingest. We're giving people very powerful medications, and we don't want any interference with that. Our ultimate goal is to keep everyone, your loved one and the other patients and staff and you, safe while you're on this unit. Please understand that every rule that we have and guideline we have is designed for one purpose and one purpose only, and that is to keep your loved one and other patients safe. And I apologize, I do apologize for any inconvenience that some of these rules might impose on you, but they're there for the safety of the patients and for you. One more thing, please forgive yourself and be kind to yourself. Don't blame yourself and don't blame the patient, your loved one, on the unit. We're talking about a chronic, progressive, pervasive, biopsychosocial, spiritual, and family disease. No one causes it. Some of you might even be blaming yourselves about involuntarily committing your loved one. You did the right thing. Just like if somebody got hit by that Mack truck, you wouldn't negotiate, you'd bring them to the hospital for help. You did the right thing and possibly saved their lives. We need you. We need you to be engaged in treatment. We need you to support and participate in ongoing aftercare. We need you to understand that together, as a family system, we can treat and beat this horrible, horrible illness known as mental health disorders and substance use disorders. Remember, we're talking about a disease. We didn't cause it. We can't cure it, but we can absolutely treat it and live with it and live a successful life. Please understand, denial is the hallmark of this illness, and it's those statements in our heads, in our loved one heads, that said, we don't need help any longer, we've got this. Please remember that aftercare and treatment after Southeastern is crucial to the ongoing success. Again, I thank you for being here. I look forward to working with each and every one of you. Our team is committed to assuring that your loved one lives a lifetime in recovery and reaches their maximum potential. We're going to spend a moment now talking to a family member, Bonnie, who has a loved one who's been in treatment with us several times, and talk a little bit about her experience. Again, thank you for being here.
Hi, my name is Bonnie. I'm so happy to be a part of this family orientation. I have a brother that I've been dealing with a mental illness for over 30 years. And it's brought many challenges, but it's also brought a huge learning experience for all of us about his disease state. One of the greatest things that we've learned is that we can't be his enabler, that we can't allow him to manipulate us for his wants. We have to remember to only provide for his needs. Through this journey, we've had ups and we've had downs, but one of the things that I've learned is if I'm his advocate and I can express to his caregivers things that I know and observe that are triggers for him, things that will bring about some psychotic break, that I can represent him by telling his story. For my brother, for example, if he would shave his entire beard or mustache off, then we knew we were headed for a psychotic break. And sharing that information to the caregivers and providers will only help them to have more insight to things that they can't see or know in the time that they've had to observe your loved one. Be careful to not get sucked up into this disease. It is very debilitating for a family. And for myself, I had been his guardian for over 12 years, and I had to stop. I had to go back to just be his sister. And he now has another guardian. And I've learned that by doing that, it's become healthier for our relationship. However, I'm still impassioned about whatever his needs are and being his advocate. Your time that you're going to spend here in our hospital as a family member visiting and your loved one being here is crucial to the future of their health. You have to remember any of the rules that they're sharing with you, any of the parameters that they're giving you is to protect your loved one and to allow you to understand the disease and remember that keeping them safe is their main goal. It's very tempting when they try to, beg you and plead with you to do something for them. You have a lot of guilt. I did, and sometimes I still do. But through my process of 30 years, I've learned to separate what is his manipulation of me to what is healthy for him and get him only his needs and not his wants. I hope you'll take advantage of all the education opportunities they have. Hope you'll ask questions. Don't judge yourself too harshly. I know it's easy for me to say that to you, but I've done that. I've been there, so I feel I can come from a real place of having been there. You'll have people who won't understand what your life's like with your loved one. They won't get it. And they may never get it, because unless you live it, you maybe can't get it. So forgive yourself for doing what you needed to do to get them their treatment, but also treat yourself. Ask questions, use the services that they're going to offer and provide so that you as well can stay healthy. I hope you'll enjoy this whole journey that we're trying to provide to you. It's coming at a time of crisis for you and your loved one, but we feel very passionate about educating you and letting you know that we're here for you.
We do something really special in psychiatry on 3rd East. We give your loved one an opportunity to learn and to practice and to live a life of recovery in a safe environment where they can attend classes, receive psychotherapy, receive recreational assessments and therapy, receive medication classes on how to take their medications, be monitored about their medication adherence, watch for reactions with the medications that we give them and the positive benefits that we're seeing of them in a safe environment where they can begin to embrace this journey. Please don't rush that experience. It is so unique, and we firmly believe that your loved one and you as a family member will be able to take this experience and practice it once you leave the hospital, and again live a lifetime in recovery.